Welcome, and thank you for viewing SharpLight's Skin Rejuvenation Refresher Training. We hope that you enjoy this tutorial. What does skin rejuvenation do? It selectively heats the targeted tissue, which initiates neocollagenesis, or new collagen in the dermis. The secondary wound healing response begins, which leads to epidermal regeneration. Melanin and hemoglobin absorb the light or optical energy, at which point thermolysis occurs. Before embarking on any treatment, it is imperative that the certified SharpLight technician perform a consultation with the potential candidate. A consultation is important for many reasons, as you learn during the initial training. However, as a reminder, here's a list of some reasons why. To assess patient or client eligibility in relation to their medical health history and consent for treatment. To determine the Fitzpatrick skin type. To assess the patient or client's expectations of treatment and reasons for wanting to have the treatment done. To review potential risks and benefits associated to the treatment. To review treatment compliance. To review patient or client pre- and post-treatment protocols. An average consultation takes approximately 30 minutes. During this time, the following must be done. The patient or client must read, understand, fill out, and complete a medical health history form, as well as an informed consent form for treatment. The patient or client expresses why they want the treatment done and their expectations of the treatment. The patient or client's Fitzpatrick skin type must be assessed. The certified SharpLight technician must inform the potential patient or client of planned treatments, treatment compliance, treatment indications, contraindications, realistic expectations, possible treatment risks, as well as possible treatment benefits. Photographs should be taken prior to the treatment and should include a patient or client's name, date, and treatment type. Photographs should be taken before the treatment series begins, midway, and after the last treatment. A test patch or skin test must be performed prior to the initial treatment. For skin type 1 to 3, the practitioner must wait 30 minutes to 2 hours to assess the response from the test patch. For skin type 4 and 5, the practitioner must wait 24 to 48 hours to assess the response from the test patch. It is crucial to ensure the safety of the patient or client by maintaining the appropriate treatment procedures, such as the proper cleaning of the equipment and treatment room space. The handpiece must be disinfected prior to treating any patient or client. If the handpiece is placed in their respective resting place on your device during the treatment, that area needs to be disinfected as well. The treatment space must be kept clean and should adhere to the parameters of your local regulatory or governing bodies. After waiting the appropriate time to assess the patient or client's response to the test patch, and after the assessment, if this individual is determined to be a candidate for treatment, the following needs to be performed prior to the treatment. Check to see if there have been any changes to their medical health history forms and update their file if necessary. Verify that the patient or client is not tanned. The treatment site is cleansed from makeup, creams, perfumes, etc. The treatment site must be cleansed even if they are not wearing anything on their skin. If there is hair in the treatment area, it must be removed prior to the treatment and only if they are okay with it not growing back. Avoid a man's beard. Verify that both the patient and the practitioner are wearing the appropriate protective eyewear. Disinfect the handpiece. Set the appropriate treatment parameters. When conducting a skin rejuvenation treatment, it is important to have full contact of the sapphire tip to the skin. In areas that are difficult to achieve contact, such as the forehead, you're able to use your SharpLight templates to block out the exposed areas. It is also important to avoid pulsing on the hairline or the eyebrows, as it may cause injury to the skin and it may cause hair loss in those areas. Skin rejuvenation requires no pressure. The areas intended for treatment are the face, neck, chest, and hands. The face and hands typically require 2 passes. The neck and chest only require 1 pass. Do not pulse within the periorbital region or in any mucosal membranes. You may use the template to block out the vermilion border if necessary. During and after the treatment, there may be a slight erythema, a darkening of the pigmented spots, and a darkening or brightening of the vessels. Throughout the treatment, it is important to ask for your patient's or client's feedback in regards to how they are feeling. It is often helpful to refer to a scale for assessment. For example, you would ask them, on a scale of 1 to 10, 1 being no pain and 10 being painful, how do you feel? Treatment reminders. The skin types applicable for treatment are skin types 1 to 5. The average number of treatments in a series is between 4 to 6 to 8 treatments. The treatments can be spaced apart every 3 to 4 weeks. The treatment is indicated for textural improvement, such as fine lines, large pores, and dull skin. It is also indicated for pigment, such as benign superficial sun damage, and is indicated for vascular concerns, such as benign superficial vascular damage. There is a 20% overlap between pulses. Should there be pressure of the applicator to the skin when pulsing? No, only enough pressure to make full contact of the applicator to the skin. Failure to apply contact could result in injury to the patient or client. How many passes can be applied? On the face and hands, up to 2 passes can be applied. On the neck and chest, no more than 1 pass can be applied. The skin in the neck and chest area is thinner and often more delicate. Do not apply more than 1 pass over the neck and chest. Areas applicable for treatment. This technology is indicated for the use on the face, neck, chest, and hands. How far away do I stay from a tattoo when I am working with this technology? You must stay a minimum of 1 centimeter away from a tattoo. Failure to do so could result in injury to the patient or client and damage to the tattoo. Photorejuvenation is indicated for textural damage, such as fine lines, large pores, elastosis, and dull skin. A fold is often too far gone and requires more invasive procedures. Photorejuvenation improves the skin's texture by a process of collagen remodeling. This technology is indicated for the treatment of benign superficial pigmentary skin damage, such as solar lentigo or dyschromias. This treatment is indicated only for benign epidermal pigmentary solar damage, not for dermal nevi. Photorejuvenation is indicated for the treatment of benign superficial vascular lesions, such as telangiectasia, erythema, broken capillaries, poikiloderma, spider veins. This treatment is effective for small superficial blood vessels and not for large, deep vessels, such as leg veins. Do not treat suspicious lesions that present these attributes, dark brown or black, and are non-homogeneous, undefined or asymmetrical. Did the lesion change its color? Height can be felt or seen. It is non-solar in origin. It has been there since childhood. Do not treat suspicious lesions that present these attributes. Do not treat suspicious lesions that present these attributes. These are examples of benign superficial sunspots. Following the treatment, it is important to properly care for the patient or client before sending them on their way. It is important to ask how the patient or client is feeling. Examine the response of the treatment site. Cool the treatment area with cold compresses, not ice packs. Apply a soothing gel. Should the treatment site be exposed to sunlight, the patient or client must be protected from the sun by the use of SPF. Protective clothing is also recommended. Document all details relative to the treatment, inclusive of date, treatment number, treatment site, fluents used, and pulse duration used, lesion type chosen, number of pulses used during treatment, etc. Additionally, document the patient or client's response to treatment. For example, solar lentigo darkened. The treatment site had a mild transient erythema. Patient tolerated treatment well, is satisfied with results, etc. A detailed and accurate file is crucial. This file is to be updated each and every treatment. Post-treatment, it is important to 1. Immediately cool the treated site. 2. Avoidance from sun exposure, artificial tan, or dirt. 3. If the patient must go outside, sun protection of an SPF of 30 or higher must be applied and reapplied as necessary. 4. Avoidance of friction, such as picking, scratching, rubbing, exfoliating, etc. 5. Maintain proper hygiene by keeping the treated area clean. 6. Keep the treated area moist with soothing gels or healing ointments. 7. Makeup should be avoided until the treated area has healed. 8. Review post-treatment compliance with patient or client. Desired immediate responses may include textural, slight erythema, warmth, light stinging sensation, pigment, immediate darkening of the pigmented spots, vascular, immediate darkening or brightening of the vascular lesion. Sharp Light Technologies thanks you for watching this tutorial. For further information, please refer to your Sharp Light Clinical Training Manual and User Manual.